Zach, changes to the state's Medicaid program are on the table as the Trump administration tries to reduce America's $19 trillion debt. The state program relies heavily on federal money. Mid-Missouri nursing home people say those changes could put them out of business and their patients could be looking for new homes. Tonight in a KRCG 13 special report, Garrett Bergquist looks at the costs of the proposed Medicaid cuts.
Vivian Casey is eligible for Medicare and the military's TRICARE, but Medicaid pays most of her medical bills.
If something happens, I'm like a lot of other people, I won't have any insurance.
That something is cuts to Medicaid. The Congressional Budget Office says the national debt now equals 77% of America's gross domestic product. Unless spending policies change, the debt could reach 150% by 2047. To reverse this trend, President Donald Trump's proposed budget cuts $3.6 trillion from the budget over the next 10 years. The cuts include changing Medicaid funding to a block grant model. This would provide lump sum funding to the states. It would save the feds more than $600 billion over 10 years. That's in addition to a reduction in Medicaid provider taxes the Senate is proposing. Ben Schulin's company runs 8 nursing homes in Missouri. 2/3 of his patients use Medicaid. He says he already faces a 24% drop in revenues next year due to state cuts.
I can't add enough residents to offset the cut that we're going to receive from Medicaid next year.
Schulin says he can't rule out layoffs to make up for it.
I don't have the number of nursing staff. I don't have the number of housekeepers. All those people, when I have to start making those cuts, the residents unfortunately are going to feel that.
If Congress approves federal Medicaid funding cuts, Schulin says his reimbursement for each patient would drop by nearly 1/3.
I don't see how one company across the state or across the country would survive. In all honesty, these cuts are too massive for anyone to be able to withstand them. It's just, there's just no profitability left in the industry if you take those massive of cuts out.
Casey says if she loses Medicaid benefits, Medicare and TRICARE won't be enough.
I'd take a gunny sack full of pills, so no, I probably wouldn't be able to afford them.
If you did lose some of your Medicaid benefits, would you be able to continue living here?
No. No, I wouldn't.
Where would you go?
It's a good question.
That's a dilemma some 60,000 Medicaid users in Missouri nursing homes could face. Reporting in Jefferson City, Garrett Bergquist, KRCG 13.
The American Health Care Association says there are 515 nursing homes in Missouri. Schulin says in some of those homes, every single resident relies on Medicaid.